So this is a study based on DESTINY-Breast04, which is really well known to all of you, using a comparison between Trastuzumab deruxtecan versus treatment's physician choice in hormone receptor or HER2-low HER2 metastatic breast cancer. So as you know that T-DXd is beneficial comparing to regular chemotherapy, that's already known, but the big question is there a molecular marker that will help to identify who will respond better to T-DXd? The hypothesis has been that if you have a DNA repair dysregulation or HER2 level, the outcome could be potentially different. So in this study, not all patients, but many patients got tested for NGS, RNA-seq, and multiplex imaging. And what we found out is regardless of the molecular status or genomic changes, there is a superior effect of T-DXd comparing to treatment's physician choice. So it tells you that whatever we like to believe that there's a definitive biomarker, that is something that we don't see. So which is good in some way, that you should be providing this treatment regardless of the biological background. There are some hint in HER2 expression level. When you have a higher level, there is a potential benefit of T-DXd, or cell proliferation, G2M phase changes may have an impact. Also for tumor microenvironment, when you have a high level of lymphocyte infiltration, total lymphocyte infiltration, there is a benefit on T-DXd. But once again, the number is small, and the p-value has not met, basically based on the statistical analysis, it did not meet what we'd like to see. So it's really more of a hypothesis generating. So the conclusion, once again, is T-DXd is effective regardless of whatever molecular changes we have in the tumor.